I'm Jason Dunn, Director of Business Development of Fourth Power Labs. We are excited to bring you today's webinar, Alleviating Treatment-Resistant Pain with CBD, presented by Dr. Rakna Patel. This webinar is a continuation of Fourth Power Labs' commitment to helping medical professionals serve their patients better. Today, I have the pleasure of introducing our speaker, world-recognized cannabis medicine expert, Dr. Rakna Patel. Dr. Patel is the Chief Medical Advisor for Fourth Power Labs. She completed her undergraduate studies at Northwestern University and earned her medical degree from Touro University and is licensed in the state of California. After spending time training as an emergency medicine doctor and working with patients to help alleviate pain, Dr. Patel ventured into the field of cannabinoid medicine in 2012. In 2014, she started her own practice so that she could offer people care they otherwise didn't have access to. Her consultations have helped thousands of patients relieve their symptoms, transform their health, and live a better quality of life with cannabinoid products. Now, on a mission to impact lives beyond her lifetime, she's published a book in partnership with Penguin Random House, has grown a YouTube channel to over 1 million views, has been interviewed on over 300 podcasts, serves as a go-to media correspondent, has taken the stage internationally educating both medical and non-medical audiences, and most importantly, dedicates her time to educating other medical professionals about cannabinoids. Please welcome Dr. Patel.
Thank you so much, Jason, for that lovely introduction. As Jason said, one of my main missions now, having been in the industry since 2012, is to impact lives beyond my lifetime. And my means of doing so is by educating other medical professionals like yourself so that you can then incorporate cannabinoids like CBD into your practice. So today, I'm going to give you a broad overview of the endocannabinoid system. I will walk you through the difference between hemp and marijuana, as well as uses of CBD for specific ailments, including migraines and headaches, muscle and nerve pain, anxiety, and insomnia. All right, to begin with, what is the endocannabinoid system? So, to fully appreciate the rationale behind the medical use of cannabinoids, it's really essential to know about the endocannabinoid system. So that's where we're going to start. And basically, the endocannabinoid system is a homeostatic system that regulates multiple physiological processes, including modulation of pain, appetite, mood, etc. And so if I had to sum it up, the core function of the endocannabinoid system is to relax, to eat, to sleep, to forget, and to protect. Now, what is the difference between hemp and marijuana? So, just like any other regulatory system, there are different ligands that interact with receptors within the endocannabinoid system. And these ligands fall into three main categories. They fall into the categories of endocannabinoids, of phytocannabinoids, as well as synthetic cannabinoids. And overall, cannabinoids are any chemical that interact with the endocannabinoid system through its receptors. Now, endocannabinoids, which are also known as endogenous cannabinoids, are made, as the name implies, endogenously by the body. Whereas phytocannabinoids, again, as the name implies, are made by the plant, specifically the Cannabis sativa L species. Now, within the Cannabis sativa L species, this family of plants, you have hemp and you have marijuana. And the main difference between hemp and marijuana is that you can essentially think of them as siblings. Siblings with really one main difference, which boils down to the amount of THC. And this difference is a legal distinction. That's important to keep in mind. So by law, hemp has less than 0.3% THC, and by default, then marijuana has more than 0.3% THC. Okay, so any product derived from hemp has to have less than 0.3% THC, and any product that then by default derived from marijuana will have more than 0.3% THC. Now, both hemp and marijuana make THC and CBD. And I want to walk you through the main difference between THC and CBD. And really, ultimately, the main difference in this case boils down to the potential for psychoactivity. So THC is the primary psychoactive component of cannabis. And when consumed in excess amounts, it causes psychoactivity. CBD, on the other hand, has no psychoactive effect. And so even when consumed in excess amounts, it will not cause any psychoactivity. And that is the most important thing to know when it comes to the clinical use of both THC and CBD. All right, now, what does CBD work for? Okay, so, CBD is being touted as a cure-all for all sorts of conditions. But really, in my clinical experience, what I found is that it's highly beneficial for some very common conditions that you may encounter in your practice. So migraines and headaches, muscle pain, nerve pain, anxiety, and insomnia. And I want to walk you through the clinical outcomes that I've seen in each of these conditions. So let's start with migraines and headaches. So migraines and headaches, the CBD affects in three different ways. It affects the frequency of migraines, it affects the duration of migraines, and it affects the severity of migraines. Now, when it comes to the frequency of migraines, here's what most of my patients have reported. They tell me that prior to using CBD, they were having, on average, migraine headaches about 1 to 3 times a month. With the use of CBD, their migraine headaches reduced in frequency to about once every 3 to 6 months. And so you can imagine the difference in quality of life that can make for an individual from experiencing migraines almost weekly to, once every couple months. And then in the best case of scenarios, I've had patients report back that they haven't had a migraine headache since they started using CBD. The next area, like I mentioned, that the CBD affects is duration of migraines. Now, what's commonly prescribed for migraines are triptans, a class of medications known as triptans. With triptans, patients absolutely have to catch the migraine at just the right time. And if they don't, they end up having to bear through the migraine for the next 2 to 3 days, which can be a miserable experience. With CBD, patients reported that they were not limited to using it only within a certain time frame. And when they did use it, the migraine headache duration lasted for about 1 to 2 hours within utilizing the CBD. Severity of headaches and migraines. So with severity, it really depends on the level of severity that the patient is starting with. And what I would say is that on average, what patients have reported is that, most of the time their migraine headaches are anywhere between a 7 to 9. And starting at that level, the use of CBD helps to drop down the pain to 1 to 3, wherein they're now able to function through the pain as opposed to being completely debilitated by the pain. Okay, now the next area that the CBD helps tremendously is muscle pain. And we're talking about the full range from spasticity to spasms to contractions to twitches, you name it. And within this realm, let me walk you through what patients have reported. Some patients have reported that they don't experience quite as many muscle spasms. Others have reported that their spasms don't last as long when using CBD. And then there's others that have reported that their spasms haven't been as severe. So that's muscle pain. Now, nerve pain. With nerve pain, so we're talking about mild to moderate nerve pain, okay? There are certain types of severe nerve pain where the CBD is not as effective, I found, and that typically falls into the category of shingles as well as spinal stenosis as well, when there's severe spinal stenosis. Okay, so in terms of mild to moderate pain, those within that category that experience severe pain, they report moderate levels of pain with the use of CBD. Those in moderate pain report mild levels of pain with the use of CBD. And then those in mild pain report an elimination of pain with the use of CBD. Now, as you can imagine, there's also an impact on the use of prescription medications as well as over-the-counter medications. So for some, CBD helps to reduce the use of their prescription pain medications. Either they're able to cut back on the dosages of medications, or they cut back on the number of medications that they're taking. And in some cases, patients are completely able to come off of their prescription pain medications, and they're able to manage their pain with the use of CBD alone. Okay, another area, another diagnosis that CBD helps is anxiety. And really, I think the most impactful way to walk you through the outcomes that my patients have experienced is to walk you through some of the phrases that patients have reported back to me over and over again. So many patients have reported feeling more calm and relaxed. Patients report that they no longer feel paralyzed by their anxiety. Then others report that, oftentimes when they hit the bed, the racing thoughts that they have disappear. And then I've had others say that when it comes to work, they're more focused and experience better concentration. And then finally, I've had patients say that they're not obsessively worried, snappy, or irritated, which, as you can imagine, has a significant impact on their professional relationships as well as their personal relationships. Now, the other thing that I want to touch on is that, again, also in this case, the use of CBD has impacted the use of prescription medications. Commonly prescribed medications for anxiety include SSRIs and benzos. With SSRIs, oftentimes one of the most common side effects is reduced libido, which is not the case with CBD. Okay, so that's a medication that a lot of patients don't desire to stay on long term, at least. So it helps to reduce, not only reduce, but most of the time eliminate the use of SSRIs. And then also patients are able to have an easier time coming off of benzos. Benzos have a high potential for addiction. And oftentimes when patients try to wean off of the benzos under, of course, the supervision of their physician, they experience a lot of withdrawal symptoms. But with having the CBD in place and then weaning off the benzos, they're able to experience little to no withdrawal symptoms and able to come off of it easily. Okay, and then finally, another area that the CBD helps is insomnia. Okay, so with insomnia, you may have heard this, difficulty sleeping can consist of difficulty falling asleep, staying asleep, frequent awakenings, or waking up feeling groggy and tired. However, with the use of CBD, patients have reported that they're able to fall asleep easily, they're able to stay asleep. It's typically a good 7 to 8 hours. And then those that happen to wake up frequently during the night, this can include, for instance, patients who, for whatever reason, have frequent urination. They're able to fall back asleep easily. And then overall, these patients report waking up feeling refreshed, not groggy or tired, as can be the case with the use of over-the-counter sleeping aids or even prescription sleeping aids as well. Again, as you can imagine, the CBD also impacts the use of medications in this case as well, both over-the-counter as well as prescription medications. Okay, so next thing I want to go over are the line of Fourth Power Labs products and dive into the details of their clinical uses. So first and foremost, you'll notice that there is a wide range of formulas available in a variety of strengths. There are oral formulations, there are sublingual formulations, as well as topical formulations as well. So here is an example of a sublingual formulation. Couple different things that I want to point out to you. With the Fourth Power Labs products, if you look at the third chart down, and if you look at next to CBD, it says 17.6 milligrams of CBD. You will know down to the 10th of a milligram how much CBD is in the actual product, which makes then guiding your patients on dosing more accurate. So that's one thing that I want to point out to you. And then the other thing is that if you look at the dropper over to the right, it's calibrated. And this is incredibly useful because you can break down that 17.6 milligrams into halves, into quarters, into 3/4, however you deem appropriate for your patient in terms of dosing. So that's another important consideration as well. Now, the other thing that I want to point out is if you look closely next to delta-9 THC, again, in the third chart down, it says ND. ND stands for not detectable. So let me elaborate on that further. Okay, so this is a more in-depth look at the laboratory test results. And if you look at delta-9 THC, next to that, it says less than, I believe it says less than 0.005%, okay? So essentially, it has less than 0.00% THC, making it a broad spectrum CBD product. So this is what's, any product on the market that has less than 0.00% THC is known as a broad spectrum CBD product on the market, as opposed to a full spectrum CBD product, which has somewhere between 0.00% THC and 0.3% THC. Okay, so that's another important consideration as well. And then finally on the market, you'll also find isolate CBD products, which again have 0.00%, less than 0.00% THC, but none of the other cannabinoids. It just has CBD. So that's another important factor to keep in mind as well. Okay. What's important to know is that it is important to have the other cannabinoids because there is what's known as a synergistic effect going on. Okay. And so, clinically, what I've found is that it's important to have the other cannabinoids there. Okay, then we have the oral soft gels. So here's an example of one. And again, you'll know down to the 10th of a milligram how much CBD are in these products. So again, if you look at the third chart down, there's 22.53 milligrams of CBD in this particular product. There is non-detectable levels of delta-9 THC as well. And this is going to be a fixed amount. So again, it makes dosing easier for your patient. When it comes to oral soft gels, it's important to take them on a full stomach and with something heavy in fats because CBD, as well as some of the other cannabinoids, they are what's known as lipophilic. They like fats. So you want to essentially give it some sort of glue to stick to so that it gets absorbed better. Okay, so sort of zooming in on the delta-9 THC again amount. If you look closely, it says less than 0.005%. So again, less than that 0.00% THC, making it a broad spectrum product. So you have negligible effects of the THC, not likely to cause psychoactivity, but you still have the CBD and you still have the other cannabinoids to lend to that synergistic effect. All right, then we have topicals. So topicals, same thing, you'll know down to the 10th of a milligram how much CBD is in the product. In this case, again, look at the chart down. It's 711 milligrams of CBD, and the delta-9 THC is non-detectable. The important thing to know about topicals is that they're very locally absorbed. You don't have to worry about any systemic effects. And because of that, it can be applied as often as needed. Usually takes about up to 20 minutes to take effect. And I have told patients you can reapply it every 2 hours if needed. So that's the other important thing with topicals. Now, the other thing is, same thing, the amount of THC in this case is less than 0.0025%. It's non-detectable, and it's a broad spectrum CBD product. Okay, how do you combine the use of CBD products? So here's an important general rule of thumb. You don't want to combine internal products, but it's okay to combine an internal use and an external use product. Okay, so just to show you some examples here, it's okay to combine a sublingual with a topical and an oral with a topical, but what I would not do is combine a sublingual with an oral. The reason being, because the CBD gets stored in the fat cells in the body, there's a cumulative effect going on. So you want to take that into consideration when you recommend products to patients. Okay, I am going to pass the baton back to Jason.
Thank you, Dr. Patel. There is no doubt that hemp-derived CBD is the topic of discussion and that many of your patients are misinformed or uninformed about the potential benefits CBD products offer. At Fourth Power Labs, we believe in the transformative role hemp products can play in your patients' lives. We also believe these products do not belong on the shelf of your local convenience store and administered casually. For the most effective care, hemp products should be taken under the guidance of medical professionals like you, with dosing recommendations informed by the patient's medical history and knowledge of interactions with other treatments. Fourth Power Labs was created with you, the chiropractor, and your patients in mind. Whether you are new to CBD or looking to revitalize your CBD cells, Fourth Power Labs is committed to providing a safe, reliable product bolstered by educational resources that empower you to speak to your patients with confidence and knowledge. On behalf of the entire team at Fourth Power Labs, I would like to thank Dr. Patel for her insight, and most importantly, thank you, our audience, for your curiosity, interest, and time. Within the next couple of days, you will receive an email asking for your feedback. Additionally, we would appreciate your recommendations on topics you would like us to present on in future webinars. If you found value in today's information and want to register for future webinars, you will have a chance to do so on the email I just mentioned, or you can subscribe to our newsletter at fourthpowerlabs.com. This concludes our presentation. Thank you again. We look forward to partnering with you on your journey to make better happen.